Hello, Mr. Watt. My name is Hunter Dimple with Glendale WMSA. What brings you in today?
So I was just doing my regular patrol. I got hit by another car. It swung me pretty good, banged my head a couple times. I believe I hit the window of my car. I don't remember, and I have a massive headache and my neck hurts. I just want to make sure I don't have a concussion or anything.
Hey, my boy, you got a
Uh,
concussion.
can you tell me when this instance occurred? Was it like an hour ago? Did it just happen?
It happened before I came to HP. I don't know how long ago. I don't remember.
Okay. And on a scale from 1 to 10, how would you rate your pain?
A solid four, maybe a five.
Okay. Well, can I grab you a glass of water while I go get the doctor?
Yeah, that's fine. You want me to lay on the bed?
Yeah, go ahead and lay down for me if you don't care, and the doctor will be in here shortly. Hey, Illy, we got a patient that came in. He had was in his cruiser and he got hit. He said he's banged his head up against the window or banged his head up against in the car. And he rates his pain anywhere from a 4 to 5 out of 10. He just want to get checked out, make sure he doesn't have a concussion or anything.
Okay, perfect. I'll be right in with him. Okay, Mr. Wyatt, my name is
And can you
Dr.
please hold
Illy
your mic?
Fields.
If
Can you please describe your
and the
symptoms
ones that's
and
been
how
role
long they've
playing,
been occurring for me?
It just started right after the crash.
Okay. And on a scale from 1 to 10, how would you rate your pain and where is your pain located?
It's about a four or five out of a 10. It hurts on the left side of my head, all around it. My neck is killing me from the very top to very bottom. It hurts very badly.
Okay, and is your neck radiating pain from the headache or is that a separate injury?
I don't know.
Okay, we will check both out. Let me put on my gloves. First, I'm going to have Hunter here assess your vitals. Do you have any allergies I need to be aware of?
Not to my knowledge.
Okay, perfect. When he's done with the vitals, I will get you hooked up on an IV and get you pain medicine stat.
Okay, I'm going to go ahead and get your temperature.
All right.
Next, I'll be getting your blood pressure and then your pulse. All right, Illy. His temperature is 98.6. His blood pressure is 120/63, and his heart rate's 89.
Okay, perfect. Vitals are stable. I'm going to go ahead and hook you up with this IV so we can get you some pain medicine before I begin my exam or do any further imaging.
Okay. Sounds good.
Okay, for this, you're going to feel a small pinch. If anything hurts, give me a holler and let me know. On the count of three, I'm going to insert this IV. 1, 2, 3. Oops, sorry about that. I'm going to go ahead and give you some IV fluids.
Alrighty.
All right, and I'm going to give you some IV pain medicine to get you started. This can take a couple, minutes to like kick in. You might feel not too much pain, maybe just like a little bit of
What?
coolness or a little bit of burning as the medication goes in. Just let me know.
You're gonna do what to
All
me?
right. Will do.
me and Mom's gonna have to fight.
Okay, how are you feeling?
My head still hurts, and the neck pain's not going away yet.
Okay, so what we're going to do is I'm going to begin a quick physical exam of your neck and
That's
of
your
your head.
mama. Don't
While I'm
fight.
doing that, I'm going to have Hunter here turn on our x-ray equipment for your neck and I will run an MRI of your brain. Just give me 1 second and I will begin this exam. If it hurts at all, give me a holler, let me know, and I'll stop where I'm at.
All right. Will
You
do.
go stand until she's done. Come on.
Okay, so I'm seeing a little bit of swelling to the neck, no deformity between your head or neck though. I do think that we need to take a closer look with x-ray and MRI. Are you okay with proceeding with that?
Yeah, of course. I'm used to MRIs.
Okay, so for the first, I'll do an x-ray of your neck. We're going to lay back and just try and remain as still as you can.
All right.
Okay, I'm just looking here. I see no visible fractures, herniations, or anything of that matter. I do see some soft tissue swelling, however.
Okay, what does that mean?
So what that means is the tissues in your neck, not too deep like bone level, but right under your skin, the tissues there are actually just a little bit inflamed, a little bit swollen, which would explain the swelling that I felt and saw on your physical exam.
Okay.
I'm going to now cross over to an MRI of the brain. Okay, just taking a look.
Okay.
So I'm not seeing any skull fractures or internal bleeding. I'm going to need to administer a couple questionnaires for you. This is the SCAT-5 or the MACE. This is going to check for your attention, recall, and brain function. I just need to assess whether or not you have a concussion. So it's going to be just a couple questionnaires I need you to fill out and a neurological examination.
Okay.
Okay, Hunter, will you proceed with giving the patient, just hand him his questionnaires. We're going to step aside, and when he's done, he'll let us know. Okay, we're going to allow you to finish this. I'm going to update your chart, and I'm going to get ready for a neurological examination when you're done. Just give us a holler when that is completed.
Will do. All right. There you guys go.
All right, perfect. So I'm going to begin with the neurological examination. I'm going to start by having you try and walk in a straight line. I'm going to assess your balance, and then we'll take a look at your eye movement, coordination, reflexes, things of that nature.
All right. Where do you want me to walk at?
Just slowly back and forth in front of you. Yep.
You need any more? One more time or no?
Nope, that was good. Okay, and I'm going to have you look right at me here. Okay, and just follow my finger as it moves. All right. Are you able to bend forward at all?
No, I can't. My back hurts too much.
Okay, no problem. Let's have a seat back at the table. All right, I'm going to hold on back by your hands and I'm going to give a push. I would like for you to try and push back. Same thing, I'm going to grab your feet. I want to see if you can push your feet back. I'm testing your strength. Okay, so What I'm seeing here is just a minimal deficit as far as balance. You were able to track me, but it was a little bit slow. Your strength is there, not as much as I would like it to be, and your coordination is also a minimal deficit. I would definitely, based on your answer in the questionnaire and the neurological examination, rule this a mild concussion. You also have soft tissue swelling of your neck.
Okay.
So, for treatment for that, I would like warm compresses and over the counter pain relievers. Given the extent of it's not severe, but with minimal swelling, I would definitely like you to have a not non weight bearing, but I guess minimal movement, I would say. And I can provide you with a work note.
Okay, that'll be fantastic.
Okay, perfect. So I will have Hunter go to the computer and write you up a work note. For sure, for the neck, I would like you to be off work for a week. For a concussion, I would like you to take at least 2 to 4.
Okay, it depends on whatever my chief gives me, you know.
Of course, of course. And if you have any worsening headache, if you get dizzy, if you know anything like that, I would like you to come back and see me immediately. As for your neck goes, I want you to alternate ice and heat. I would also like you to take the over the counter ibuprofen. If it happens to continue to hurt, if there's any more injury, I would like you to come back and see me and we will redo an x-ray and I could possibly up the dose of medication if the ibuprofen is not working.
Okay, will do.
Okay, and as far as your headache goes, you can stay in like a dark room, dim the lights, minimize the noise, that kind of deal. The ibuprofen should help with any swelling. I'd like for you to stay away from things of like Wordle or anything like that. I don't want to increase the risk of brain bleeding given the injury. So we'll just keep it minimal, Tylenol, and yeah, warm compresses. You can use ice, things of that nature.
Okay. Could you guys put in there my work note on how long I can be away from work?
Yes, we can for sure. I also would like for you to follow up with me in about 1 week. Same time, and 1 week from today is Monday, so the 13th around the same time. Does that work for you?
Yes, it does.
Okay, perfect. All right, Hunter, you can go ahead and get started with his insurance or payment. And we have him his discharge paperwork and work note.
Okay. Do you have insurance, or are you going to be paying with a debit or credit card?
I'll be doing a debit or credit card.
Okay. Let me go run it by the machine. All right. It looks like everything went through. Here's your debit card back.
I appreciate it. Thank you.